coronavirus case count has now surpassed 6 million in the United States. And Dr. Fauci had to go out there and debunk a widely circulating theory that the coronavirus death toll was actually only 9,000. Now, that's a theory that had also been retweeted by the president. And just for clarity here, the current death toll stands at roughly 184,000 in the United States. So for more on the pandemic, we're joined now by Dr. Andre Campbell, a professor of surgery at UCSF, as well as a trauma surgeon at the Zuckerberg San Francisco General Hospital. So Doctor, I want to start with this theory that had been reshared by the president that said that the death count for COVID was only 9,000. That theory, of course, coming after the CDC said that in the death count, that only 6% of the deaths had nothing else but COVID. I'm hoping you can kind of break this all down for people at home to better understand.
Well, Ms. Myers, thank you for having me today. I really appreciate you having me back. So first thing is that the death toll is at least 184,000, at least. It's probably more. What they kind of confused things at the CDC for everybody because they said, oh, it's explicitly just COVID. What happens is when we fill out death certificates, and I do that fair amount in my job and working as an intensive care doctor, you basically list the different things. So COVID is one of them, but they may have diabetes, may have hypertension, they may have had sepsis. So it just adds to confusion. We're at least 184,000 people are dead, if not more. I think that most people think we're actually undercounting. So the number is actually maybe north of 200,000 right now. So there is no confusion. Dr. Fauci's right, as he always is. He's been through so many pandemics and epidemics. He knows what he's talking about. So the number is 184,000. That's the number that we have to have in our mind in order as we go forward, because we're going to keep increasing the numbers as we go along.
Now, we've seen case counts spike in the Midwest. I'm wondering if some sort of regional surge or, a regional impact of this virus was always expected. Is that just how viruses move, or is there something else at play here, perhaps masking mandates or really a lack thereof, reopening economies too soon?
So the first thing is that I think we know three things work for this, and we've talked about that. It's the masking, the social distancing, the washing hands. That actually works, right? And what has happened in the country is that at first there was an outbreak in New York and New Jersey and the Northeast, and then on the West Coast, and then everything got shut down and numbers went down. But what happened was as the country started opening up, the things started happening and the virus started doing what it does. It spreads. So we went from what was a model state. Now we have over 700,000 cases. Now we have about 13,000 deaths or so versus New York, which had 420,000, 430,000 with about 30,000 deaths or so. So we have twice the number of people. We have 40 million people. Now what has happened was outbreaks in Arizona, Texas, and Iowa. Actually, over the weekend, where 79% of the tests that were done in Iowa, right, were positive. Now, when the virus is going crazy like it is in Iowa right now, right, that's what you got. And that's where we're not even testing enough people. It should be more people we should be testing. So the number you want to look at is what's going on in New York is 1 or 2% positivity or less, right? That's more green zone. But really, there's only 2 states in the green zone, Vermont and Massachusetts. The rest are yellow or red. That means that the numbers of cases that are positive that you test out of 100 are higher, right, in those areas. So it is going through the country because there's no mask mandates. And it should be, in my opinion, universal mask mandate, because it is data that shows that we could save 70,000 lives if we mask everybody up right now. Because we're going to be, by the election and the end of the year, we're going to be north of 300,000 deaths because about 1,000 people are dying a day from this terrible pandemic.
So looking ahead at that, I'm wondering if you at all are concerned that, people are going to just get so restless, tired of staying in their homes, wanting to go out, that people are just going to start saying to themselves, hey, coronavirus is just something that we're all going to have to live with. We all know what's out there, and that everything is just going to completely reopen again.
That is, I think, well, first of all, let me say I'm a surgeon. I wear a mask all the time. And I don't like wearing a mask outside, but we have to do it now. And people are getting tired of it. And when they do, they let their guard down. And that's when people become affected. The problem is you don't know if you're going to get a mild case or you're going to get a severe case or you're going to die. And you don't know that. It could be young people, it could be old people. They said first over people 65, but now we have people were, teenagers, younger kids, 20s, 30s who get the infection and they actually die. So there's 1,000 healthcare workers who have died from this virus. So this is something that is quite serious. I mean, I encountered it every day when I'm doing my cases. I worry about it. I mask up. I do what I have to do, but it's going to be a part of our lives. Remember, the pandemic of 1918 lasted to 1920. So it was actually a 2-year process. So we're 6 months into what will be probably a year and a half thing. The panacea is the vaccine, but we have to have an effective vaccine, and we can't jump too quickly to that.